Right, let's get further reaction on the NHI. We're joined now by the South African Medical Association Chairperson, Dr. Mvuyisi Mzukwa. A very good evening to you. Thank you so much for your time. Mixed reaction to President Cyril Ramaphosa signing into law of the NHI bill today. And we have heard him talk a little bit about how it's all going to work. And what he has said is that it's not all going to happen at one go. It will be phased in. In that process, do you think the system is ready?
Good evening to you and to your viewers. We don't necessarily think that the system is ready. Like we've always been pointing out, this is just a finance aspect of things. In a healthcare system, you've got other pillars of a healthcare system. So you've got finance, you've got leadership and governance, you've got healthcare or human resources for health, medicines and technology, you've got a service delivery, you've got all this infrastructure and everything else. But in this case, we are only excited about one aspect of a healthcare system. And even that aspect, it leaves a lot to be desired. And what we are saying is that, if you are talking about access, as everybody talks about access, how are people who don't have clinics, who don't have roads for ambulances to pick them up, people who don't have hospitals in the rural areas, how are they going to access healthcare if you don't build hospitals there, you don't build clinics, if you don't hire enough healthcare professionals to be able to deliver on this NHI? How are you going to deliver? So we're not just talking about the paper, we're talking about the real experiences of people on the ground. That's why we're saying the system is not ready, but I think the president was correct when he said this is just a promise.
As you speak about some of the real experiences and, of course, shining the reality on healthcare professionals, we know that if we do have to scrutinize some of the challenges within the profession, we know just a few weeks ago, doctors in the public sector came out and spoke a little bit about how they are still waiting to be employed. And it also means that there are about 3 doctors for every 10,000 patients if we look at the situation as you and I speak. And then there's also a huge imbalance when it comes to nurses in public hospitals. How is that imbalance now going to be fixed? Will we see the NHI bill roping in some of those unemployed doctors and filling those vacant posts? Is that the sort of expectation?
Let me tell you, the NHI is going to be working exactly like medical aids. It's just a huge medical aid that is going to accommodate everyone in South Africa. But if you know how the medical aid works, it only purchases services. It does not buy, it does not build, it does not hire. So there is no expectation that the fund is going to be hiring doctors and nurses or any other healthcare professional. It is not going to be building the hospitals that are dilapidating. It's not going to be talking to the issues of ethical leadership and governance in the hospitals, where people are going to stop buying skinny jeans and doing all silly things in the hospitals. So if you're talking about a real reform, you must really consider all these other pillars. Hence we're pointing out to government that you're saying you are reforming, but you are forgetting other important aspects of a healthcare system. And we think that if government was really serious about it and not just using this for electioneering, they were going to consider our input. They were going to know that we are highlighting important issues. But before I even forget this point, I think I need to make this point that, in the past, we've got 2 incidents where the voice of the medical profession was ignored by government. One, it was during the era of the AIDS denialism. And you will know what disaster happened after that, when we voiced out to say you can't be denying people access to ARVs. And secondly, with the issue of life is demanding, the voice the voice of the medical profession was again ignored by this government, and a disaster happened, to the poor. If people are saying they are working for the poor, they don't have the track record in the country, to be protecting the poor. The poor don't have clean running water in the rural areas. They don't have clinics. We've got a government that has been sitting there for 30 years, and now close to the elections, they want to get that hype that we are going to be having, this big and nice building called NHI.
I know that you have said this in public, that you support the objectives of the NHI. What is it exactly that you're opposed to, more so as we consider your position as a watchdog for health professionals?
One, it is the fact that there is no clarity. Even in the first place, there is no consideration of our inputs. But secondly, the fact that, even during the policy development, there was no proof of concept. Proof of concept was supposed to come out from the pilot projects. But that those pilot projects were a disaster. And then the other issue is, if you are saying you are going to be reforming a system, you're complaining about the private sector that is expensive. We agree with you on that, and it needs reform. But now you've been given recommendations by the Competition Commission through the Health Market Inquiry, and said, government, you must implement these recommendations. None of those were implemented. So we've got a government that would have something on paper, but it will never implement because they don't have the capacity to implement. So the other issue that we're raising there is access to healthcare. You will recall that having mentioned all these other things, if you don't have enough healthcare workers, how are you going to access healthcare? If you don't have all these in the rural areas, how are you going to access healthcare? But also, if you are saying people would, like in Section 33, those that have medical aids, you are going to limit the role of medical aids. What happened if we face a case like in the UK, where there's a backlog of about 7.8 million people are waiting to be done procedures? How are we going to, work on those issues? Because as it is now, those people are coming to South Africa and other countries to look for private healthcare, and they are leaving the NHS. In fact, the NHS has even failed to pay doctors there. Some of the GPs there are taking their contracts back to the NHS because it has collapsed. And that is a first world country. So when we raise these issues in this country, we say we support the objective of the NHI, but do look at these other issues. Nobody is willing to listen. It really falls on deaf ears.
Yeah, very concerning indeed. Thank you so much for weighing in on this discussion, Dr. Mvuyisi Mzukwa, who is the South African Medical Association chairperson, just reacting to President Cyril Ramaphosa signing into law the National Health Insurance Bill.